Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19.
Welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, the Honourable Dorothy Shepherd, the Minister of Health, and Greg McCollum of the NBEMO.
Individuals. Dr. Jennifer Russell, the province's Chief Medical Officer of Health. The Honourable Dorothy Shepherd, Minister of Health, and Greg McCollum, Director of the New Brunswick Emergency Measures Organization. Dr. Russell. Before Dr. Russell commences, could you please ensure your microphones are placed on mute? Avant qu'on commence avec Dr. Russell, voulez-vous assurer de désactiver?
Could you please put your microphones on mute before Dr. Russell starts? It's appreciated. Thank you.
Bonjour à tous. Aujourd'hui, je discuterai.
Today I will be speaking about the status of Zone 2, an update on Parkland St. John, and further guidance on how everyone can plan for a happy and safe holiday season in this time of COVID-19.
The status of Zone 2, Parkland St. John update, and further guidance on how everyone can plan a happy and safe holiday season at this time of COVID-19. And before I go on any further, I'll just like to say a happy Hanukkah to everyone in New Brunswick. Another round of testing in Parkland St. John's Tucker Hall residents and employees was recently completed. The results are as follows. All residents tested negative, and one non-Shanix employee who was providing on-site support tested positive. So we are investigating the matter and will report back at another time. I can tell you that another round of testing will occur tomorrow, and for the employees working in the COVID-19 area, and the full nursing home will be tested again on Thursday, December 17th. Therefore, to date, there are 18 confirmed cases at Parkland St. John, 6 employees and 1 non-Shanix employee and 11 residents. Je suis très heureuse des progrès qui ont été réalisés dans la...
I am very pleased with the progress we have seen in Zone 2, which is St. John, Kings, and Charlotte counties since the area transitioned to the orange level of recovery 2 weeks ago. While the outbreak is not over, and we have not eradicated all cases of COVID-19 in the St. John area, the situation has improved.
Which is the St. John, Kings, and Charlotte counties, since the area transitioned into orange, the orange level of recovery 2 weeks ago. And while the outbreak is not completely over, we have not eradicated all the cases of COVID-19 in the St. John area. The situation has improved, and all of the cases to date have been linked to each other. So the growth in new cases has slowed significantly, and really that has to do with the compliance to public health directives by the public, and the testing backlog has been addressed. All the cases are linked either directly or indirectly to a Zone 1 case that traveled to Zone 2, and that is on our dashboard as a community transmission. There are no new cases of community transmission in Zone 2 that I am aware of. We remain concerned about the ongoing outbreak at Parkland St. John, but we are confident that it has been brought under control with a reduced risk of further spread among residents and the wider community. In weighing all of these risks, we believe the time to recommend lifting some of the restrictions on public movement imposed under our emergency order. Public Health has recommended to Cabinet that Zone 2 return to the yellow level. This will take effect tonight at midnight. And this means that the entire province will be, again, in the yellow level, and that is an achievement which all New Brunswickers can take great pride. We have accomplished this feat while other jurisdictions have struggled to cope with the pandemic's second wave. Des centaines et même des milliers de nouveaux cas sont...
Other provinces are seeing hundreds and even thousands of new cases every day. Their hospitals are overwhelmed by the sick and dying. And other provinces are seeing unchecked community spread of COVID-19, and we are very fortunate that this is not happening in the province.
still yet happen, but we have remained vigilant and we will remain vigilant. I know New Brunswickers have been quite determined, and I encourage that determination to do what is required to limit the spread of this virus. It remains necessary that we all continue to do the things that we have been doing by wearing our masks, physically distancing, washing our hands in the weeks and months ahead. And again, I commend everybody who has been doing their part. Significant sacrifices made all around this province on many different levels, and I do commend everyone. I am very proud of the work that New Brunswickers have been doing. Aujourd'hui, j'annonce qu'il y a 4...
Today, there are 4 new confirmed cases of COVID-19 in New Brunswick. There are 3 new cases in Zone 4 in the Edmundston area, 1 individual aged 20 to 29, 1 individual aged 30 to 39, 1 individual aged 40 to 49. There is 1 new case in Zone 2, which is St. John, Kings, and Charlotte counties, and this is an individual aged 30 to 39. There are currently 75 active cases in the province, with 4 individuals currently in hospital, 3 of whom require intensive care. I again ask you to keep all these people in your thoughts today, them and their family.
Cases of COVID-19 in the province. In Zone 4, which is the Edmundston area, there are 3 new cases. 1 individual aged 20 to 29, 1 individual aged 30 to 39, 1 individual aged 40 to 49. There's 1 new case in Zone 2, which is the St. John, Kings, and Charlotte counties, an individual aged 30 to 39. We now have 75 active cases in the province, with 4 individuals currently in the hospital, 3 of whom require intensive care. And I ask you again to keep all of these people in your thoughts today, as well as their families. It is exciting to have every region of New Brunswick at the yellow level once again, but please remember, yellow means caution. Everyone will still have to take great care to prevent the spread of COVID-19 so that we can maintain this enviable record. We know that cases of travel-related COVID-19 cases, as well as some community transmission that can slip in across our borders, as there is community transmission outside our borders, is very, very important that everybody take the precautions necessary to prevent the spread. Keeping New Brunswick in the yellow phase will require ongoing commitment by all New Brunswickers to wear masks in public places, maintain 2 meters of physical distance from one another at all times, and stay at home when you do not feel well, and get tested if you have any symptoms of COVID-19. It is vitally important to limit your number of close contacts and to be consistent about whom you are in close contact with. And I think with all of our experience now, having gone through many outbreaks in the last several months in different zones, the learnings that we can take away right now, that we can provide you with, so that we can all stay in the yellow phase of recovery and through the holiday season, because we know that people will travel, there will be gatherings, and we really don't want that to turn into a spike in the number of cases in early January or mid-January. We know that in the U.S. they're seeing a spike in cases after the American Thanksgiving celebrations happened. We don't want to see that here with our holiday celebrations. So to keep your close contacts at a minimal number and make sure that they are consistent. So at the yellow level, informal indoor gatherings of up to 20 people are permitted, but it is important that these be limited to a consistent circle of close family and friends. Everyone should aim to keep their social contacts, the people you spend time with without wearing a mask or maintaining physical distance, to no more than 20 individuals. And just because we're saying 20, the fewer the better, actually. So this is what will slow the spread of the virus. It will make it easier to contact close contacts when outbreaks happen, and will help keep outbreaks short and small as possible, and hopefully prevent zones from going back into orange. Il est cependant très important de ne permettre qu'au même cercle de membres de la famille.
It is very important that the close contacts be limited to a consistent circle of close family and friends. Everyone should aim to keep their social contacts, the people you spend time with without wearing a mask or maintaining physical distance of at least 2 meters, to no more than 20 individuals.
Cases with dozens of close contacts, and each of these had to go into self-isolation for 2 weeks to keep the disease from spreading. When you multiply that out, you can see how quickly we had more than 2,000 people in New Brunswick in self-isolation at one point. I strongly suggest that everyone make a list of their close contacts and aim to keep it to a steady 20 for 2020. And we will be having some information on our website around this. So if you think about your steady 20, those are the people that you relate to most closely. Stick with that and support your steady 20, and they will support you. If we all do these things, we stand a better chance of limiting the impact of future outbreaks of COVID-19. And we have a lot of experience with these outbreaks now, so we really have tracked the progress, we've tracked the transmission patterns, and we've tracked all the things that we're feeding into the spread of the virus. There will be more outbreaks. Vaccines are on the way, which is also a good news story. And with the first New Brunswickers will be inoculated in the next week. This is an exciting development that we give hope to everyone at a time when we could all use some hope. It will be several months before the vaccines for COVID-19 are widely available for the general public. So the initial stages of the rollout and the plan, Greg McCallum will be detailing those shortly. And until that happens, we will continually be challenged to keep the disease at bay. And I think that will be the biggest challenge over the course of the next 9 to 12 months. Trying to keep outbreaks small, keeping them under control and contained while the vaccine rollout happens in our prioritized lists of individuals and groups of individuals. It remains vital that we all stay on our guard to protect ourselves, our friends, and our families from COVID-19. Especially over the holiday season, it will be important to keep doing the things that prevent the spread of this disease, wearing a mask, maintaining physical distance, and keeping your close contacts to your steady 20. We have much to celebrate this year as this year draws to a close, and many will think of 2020 as a very challenging year, a year of unexpected situations that have been, again, a challenge for all New Brunswickers. But I think we have met that challenge of this deadly disease by responding with courage, determination, caring, and kindness. I owe so much to all of you in this year of such challenges. Your efforts have been what has helped us succeed and will continue to help us succeed in our journey through this pandemic. Je vois cependant cette année comme le moment où les citoyens...
But I see this year as a time when New Brunswickers met the challenge of a deadly disease and responded with courage, determination, caring, and kindness. And I owe so much to all of you. It is through your efforts that we have succeeded and will continue to succeed in our journey through this pandemic.
Good afternoon. Over the last few weeks, residents of Zone 2, the St. John region, have worked hard to get back to the yellow level of recovery. I want to thank everyone who has done their part by following the rules, by staying within their single household bubble, and wearing a mask in all public spaces. I know it has not been easy, but your dedication has paid off. I am pleased to say we are following the recommendation of Public Health in Zone 2 will return to the yellow level as of midnight tonight. This is good news. It means the whole province will be back in yellow. We are also receiving the exciting news this week that a vaccine has been approved and will soon be able to start providing it to our most vulnerable populations. We are developing a detailed vaccine plan for New Brunswick. There are priority groups who will receive this first round of vaccine next week. These groups include long-term care residents and staff from the provincial rapid outbreak management teams who respond to COVID-19 outbreaks, and you'll know that we refer to them as our prompt teams. Extramural Ambulance New Brunswick staff, healthcare workers involved in COVID units, seniors 85 and older, and First Nations nurses. This distribution plan will be carried out under the capable leadership of NBEMO Director Greg McCallum. He will provide more details about the plan shortly. We know that vaccinating our entire province is going to be a long process. There is light at the end of the tunnel, But until more vaccine doses are available, we must all continue to follow the rules that are in place under the yellow level. That means wearing a mask in indoor public spaces, maintaining physical distance, and practicing proper hygiene. It is also important that we keep our number of close contacts small. If we follow Dr. Russell's advice to limit our contacts to the steady 20, consistent family members and friends, we will help limit the spread of COVID-19, and public health will be able to carry out effective contact tracing. New Brunswick is leading the way by keeping our case numbers low and keeping outbreaks contained when they do happen. While we have had to transition zones to the orange level several times since our province came out of lockdown, we have been able to quickly get the situation under control every single time. New Brunswickers should be proud that we have kept our province in the yellow level as much as we have during this pandemic. Amongst other provinces and around the world, we are viewed as an example of what can be achieved when everyone works together toward a common goal. Thank you for doing your part to protect yourself, your loved ones, your friends, and your neighbors. Let's continue to be a positive example and work hard to keep all of New Brunswick yellow. Thank you. Merci.
Good afternoon, ladies and gentlemen. As has been mentioned, my name is Greg McCollum. I'm the Director of New Brunswick Emergency Measures. And last week, I was appointed to lead the New Brunswick Immunization Task Force. Since then, I have been reviewing the preparations made to receive and distribute the COVID vaccine here in New Brunswick. And I can assure you a remarkable amount of planning has already taken place. I'm pleased to report that we are ready to receive these shipments and to distribute vaccines so that New Brunswickers can get immunized against COVID. Now, as was referenced in previous comments, and as we learned yesterday, Health Canada has approved a vaccine for COVID-19, specifically the Pfizer ultra-low temperature vaccine. This announcement follows Health Canada's very stringent approval process to ensure product safety of the vaccine. Also yesterday, New Brunswick conducted a test. It received its first shipment, a dry run, really to validate the delivery and handling process so that we can safely take receipt of the vaccine once it's been safely transported to New Brunswick. These were all successfully completed, and we do have a confirmed method and mechanisms of receiving and thereafter administering the vaccine. Now, we expect the first 1,950 doses of Pfizer's vaccine to arrive in New Brunswick in the coming days, certainly within the next week. Now, you say 1,950. We are a population here in New Brunswick of over 700,000, and that seems a small number. But I want to reassure people that it is the first step of a regular delivery schedule which will immediately follow thereafter. Like other provinces, New Brunswick's basing its prioritization and sequencing on the work of the National Advisory Council on Immunization, their recommendations on key populations to be immunized first. And as Minister Shepherd just mentioned, these include nursing home residents and staff, healthcare workers, older citizens and adults, and of course medical staff in Indigenous communities. However, with small shipments initially and logistic limitations on the first two products, it will take some time to immunize these first groups. The first shipment of product will be delivered to the Miramichi Regional Hospital, which is the site of New Brunswick's ultra-low temperature freezer that has just been installed there. That unit for the Pfizer-BioNTech vaccine is necessary, as the vaccine must be stored at minus 80 degrees Celsius. Now, Minister Shepherd already spoke to the priority groupings, and I would like just to reiterate and emphasize that it's important to remember that although the first shipment is a relatively small number, it is the first step for many, first step of many, for this immunization campaign. We want people to understand that it'll take much of 2021 to roll out and administer vaccines to all New Brunswickers, but they will be done safely and then efficiently, and the vaccines will be brought to convenient locations for people to be able to access them. Part of the planning is recognizing and realizing that a large portion of the initial steps in this campaign will take place in winter conditions, and contingency plans for the delivery and transportation are certainly being put in place to ensure the most efficient rollout possible. So this is a very important and significant first step, this first arrival, but it's not a finish line. We'll get to the finish line, certainly, but for now, as has been mentioned, we must remain vigilant. We need to follow public health measures to protect everyone's health and safety. And even those who do become immunized early will need to continue to be vigilant and follow those same health measures to ensure that it is a safe process, a safe campaign, and that successfully completed, which it will be, all New Brunswickers can quickly get through this pandemic and be confident that this has been eradicated. Thank you very much.
Thank you, Minister Shepherd, Dr. Russell, Director McCallum. Merci, Monsieur McCallum, Ms. Shepherd, et Dr. Russell. We'll now proceed with questions from members of the media. Each member will have one question and a quick follow-up. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des...
We will now proceed with the questions from the media. You can ask your questions in the language of your choice. Each member of the media will have one question and one follow-up.
Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? Laura Brown, CTV News.
Hi there. Mr. McCallum, I apologize if you said this, but is the plan for these first initial doses of 1,950, who will be getting those doses, and will they have to go to the Miramichi Hospital to get them?
Thank you for the question, Laura. Yes, initially this, because it's the Pfizer vaccine and because it requires such low temperature storage, it will go to the Miramichi Hospital as the first tranche of this distribution. As far as the quantity and how it will be apportioned in accordance with those priorities we've just stated. Now, I want you to understand that as this is a very recent announcement as to the exact quantities of this, we are continuing to finalize the specific numbers. But several hundred long-term care residents and their attendant staff will certainly be in the very early stages of this, as will a significant number of healthcare workers, as mentioned as part of the prompt teams, people that are working in COVID units, and folks that have a direct interface with COVID patients. So The numbers are being refined. The objective here is to ensure that we administer this to the priority groups in the most efficient way possible, and we're going to touch each of those priority groups with a portion of this first allocation.
Thank you, Director. Ms. Brown, do you have a follow-up?
Wondering if you're looking ahead at trying to secure more freezers then, or if you're looking ahead thinking we're hoping that we'll get a different vaccine that doesn't have to be held in such low temperatures.
Again, another good question, and of course, part of the planning idea is looking ahead. So absolutely we are. And I don't want anyone to be under the impression that this is the only freezer with which we will store and from which we will issue the vaccine. There is an inventory of freezers within the province, and as well, the actual shippers that the Pfizer product arrives in are in effect a dry ice freezer in which things can be stored temporarily. The biggest constraint we have right now is we will receive them at the Miramichi Hospital, and because of the nature of the ultra-frozen vaccine, the advice is from the manufacturer is not to forward transport it. So that's why we'll hold the initial clinic in Miramichi. Now, to the second part of your question, I've already partially addressed it in that, yes, there will be other freezers in other locations, but also there will be other vaccines. And the second vaccine, which is in contention and is nearing the approval process by Health Canada, the Moderna vaccine, of which many probably have heard in the media, will be coming online in the near future. Certainly, that is factored into our planning. It is much easier to transport and distribute to diverse locations, and that will be integrated into the overall distribution plan.
Thank you, Ms. Brown.
Thank you.
Travis Fortnum, Global TV.
Hello. My question is also for Mr. McCallum. I just wanted to clarify something Laura just asked. So these initial doses that are coming out next week, to get those, you will have to go to the Miramichi Hospital, or like you said, will they be able to be shipped to where these other freezers are now?
No, the initial 1,950 doses will be administered at clinics which will be held at the Miramichi Hospital.
Mr. Fortnum, do you have a follow-up?
No, thanks.
Thank you.
Thank you.
Jean-Philippe Hugues, Radio-Canada.
Jean-Philippe Hugues, Radio-Canada. My question is about the Edmundston region. There are new cases today. The Vitalité Health Network said that there was exposure at the Edmundston Hospital. I am wondering if there are hospital workers who have contracted the virus. We got news on the Edmundston Hospital this morning, and Public Health is working with the Vitalité Health Network to do the contact tracing. Vitalité told the public not to come visit hospitalized patients. If you have an emergency, do not go to the ER unless it is a severe emergency. So this is what we heard this morning. But we have been conducting tests today. We are waiting for the results to give more information. Do you have a follow-up question, Mr. Hugh? Yes. I would like to know if there were employees or patients infected within those 3 new cases today. I do not have any details on all the infected people today because we're still awaiting results.
Oh, good afternoon. First for Director McCallum.
C'est quelqu'un du Canada qui vient exactement de demander ce que je devais demander.
Can you hear me?
Je confirme rien.
Peux-tu mettre ton micro? désactiver ça.
Could you please mute your microphone immediately?
Hey, still here. It's always me. For Mr. McCallum, why Miramichi? It's a way for, there's larger highways, larger airports in other cities. There's a relatively low case count in Miramichi. There'd be more healthcare workers in other cities. Why did you pick Miramichi for the location of this first freezer?
The decision to place this ultra-low temperature freezer at the Miramichi Hospital was made by public health authorities, and it was made based on really geographic centrality in the province. It doesn't matter when you speak about a singular location. It doesn't really matter where you place it if all you want to do is store something, but the consideration is about transporting forward from a facility that essentially is for storage. So it was placed there because it is, in the Miramichi area, it is central, relatively speaking, between the two regional health authorities, and geographically, it is also relatively central in the province. Now, one could argue that population density should be a factor in consideration here, but when you're looking at this from a logistic perspective, it's about time and distance considerations. And if you think by way of analogy, if this would have been placed in St. John, then people would have had to travel 4 or 5 hours if they were coming from the northern part of the province. Whereas centrally, it essentially means people from anywhere in the province could get to this facility within 2 to 3 hours at the most. But I just want to underscore something I said earlier. This one freezer is not the freezer. It's not the only freezer. And this is a progressive build, and additional freezers throughout the province will facilitate a much more even and equal distribution in terms of time and distances.
Mr. Bateman, do you have a follow-up?
I do. For the health minister. Minister Shepherd, I want to hear more about how this province decided on who was included in this priority list of vaccine recipients. Does it differ at all from the advice you got from the federal government? And perhaps, what other candidates were not included in this initial list?
Well, I think it's important to know that this is 1,950 vaccines, doses. So the priority list was derived with public health consultation at the national level and the local level. They have certainly used the federal list as a guideline, and for the most part, we're respecting it. With regards to who's not on the list, there will be more doses, there will be more rollout, and we're going to address them as we go. It's really important that we have that unity in going forward with this. It was presented to COVID cabinet. It certainly came through cabinet, but more importantly, this has been done with the recommendations, the collaboration of the federal and provincial public health teams, and that's why it was decided. Everyone will receive the vaccine between now and the time the entire province is done. And so for now, with a minimum of 1,950 doses, and the next 1,950 doses will go to the same individuals because it requires 2 vaccinations, this is where we felt the priority really needed to lie, and the opportunities that we had in the community.
Do you want to add to that?
So at the federal level, there were actually 5 organizations who contributed to the prioritization. The 5 organizations include the National Advisory Committee on Immunization, as well as the Special Advisory Committee, which I am part of. And there's some other organizations, and they all have FPT representation for the most part. One of the organizations included an Indigenous organization at the federal level. So in terms of the information that came out at the federal level, it did have input from all these organizations. organizations. And then in terms of the prioritization here in the province, again, very similar to the recommendations from NACI. So in terms of the logistics and timing and all of that, every province has within their jurisdiction the ability to make arrangements that suit their needs logistically. So that's why we're rolling out with the help of Greg McCallum leading us with the logistics side of things. And there are 7 vaccines that will be rolled out eventually. The first 2 are the ones that are more complex in terms of needing to be held at lower temperatures, but the ones after that have to be held at vaccine temperatures that are what we see normally.
Thank you, folks.
Thank you.
Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for whoever feels comfortable answering it. What can you tell us about potential side effects of the Pfizer vaccine, and what precautions are you taking to prepare New Brunswickers for certain reactions?
So on the Special Advisory Committee phone calls, we are being given advice on all the different vaccines, but this information is also being provided to deputy ministers and the premiers, et cetera. So what we will probably be doing is working with communications to make sure that once we have all that information, that it is communicated in a way that the population can understand as they receive the information. There are criteria that you have to meet to get the vaccine. The most common side effects would be the site of the injection, and there are others, but the issue around all of these new vaccines is that because they're new, some of them are a new technology even, we are committed to a very strong surveillance system to make sure that we keep track of any adverse events. And this will be very, very important as we move through the rollout of all of the vaccines.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up?
I do, thank you, Bruce. Will New Brunswickers who've been fully vaccinated for COVID-19 still be required to follow COVID-19 guidelines?
So that is also something we've been discussing at the national level, and as of right now, because we don't know how long the immunity lasts, we don't know if people will be shedding the virus and transmitting to others. As of right now, we will maintain the same advice with respect to following public health measures after the vaccine is given, but we will continue to monitor that situation. We will take into account any new information that we get on that, and if we will be making changes at a later point in time, then we will look at that.
Thank you, Doctor. Nathan DeLong, Miramichi Leader.
Good afternoon. My question is for Dr. Russell or Director McCallum. What can you tell us about the security of the vaccine and what precautions or steps will be taken to secure the storage?
Yes, thank you for the question. Security of the vaccine is always a consideration, as it is, to use the words of our Prime Minister, a precious commodity at this point. Again, another good reason why this initial shipment is going to a regional hospital, and it's specifically going to the pharmaceutical section of the regional hospital, which is specifically responsible for security and well apportioned with security measures as part of that facility. So the dimensions of security when it's in location are well addressed by the security plans at the hospital. Now, to speak to security while it's in transport, the Pfizer vaccine will be delivered under arrangements being already made by Pfizer themselves. So this vaccine will be under positive and secure control from its point of manufacturing, literally to the doorstep of the facility to which it's being delivered. And all the appropriate security measures are being taken to ensure that that is done safely and securely.
Thank you, Director. Mr. DeLong, do you have a follow-up today?
Yes, I do. What information can you tell us about the plan that you've developed for administering the vaccine? Like, how do you expect to go about administering it?
By administering it, do you mean actually conducting clinics?
Yeah, what will those look like?
Well, there is, as you could appreciate, a very deliberate approach to planning an immunization clinic. But a large part of the delivery of this vaccine, the administering the vaccine to individuals, will be done in healthcare settings. In this initial, as I've already described, scenario where at the Miramichi Regional Hospital, the initial clinics will be run. And you will see that expand to be inclusive of other regional hospitals as well. And that is, again, something that is driven by the nature of the vaccine itself and the restrictions on its transportability. But as the days go on, we receive additional vaccines. They're easier to transport. This will then be expanded, the distribution network, to outside of the regional hospitals, to regional facilities, and ultimately, we'll see a situation where pharmacists will be administering these as well.
Thank you. Thank you, Mr. DeLong. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour...
My question is to Dr. Russell and to Mr. McCallum. Is it public health who will choose who will be able to get the vaccine, or is it first come, first serve within those groups, those targeted groups?
Alors, vous voulez savoir...
You want to know who is deciding which ones are the priority groups and where will they be vaccinated? Is that the question? No. I want to know for people within those groups, within the targeted groups, those priority groups, who will be choosing who within those groups will get the vaccine first? Or will the people within those groups go in and line up at the hospital to get the vaccine? The decision initially was made at the national level, but that was information that came from the 5 participating groups, and there was representation from each province and territory. At the provincial level here, the place was decided by the networks and the health networks, and it is the vaccine as such that decides on the place, because we cannot transport it once it's delivered to Miramichi. So as for the people who will get it, the priority will be what we described first. It will be healthcare workers who work with COVID patients. It will be people in nursing homes and people who work with people in nursing homes. But if people want to travel to Miramichi to get the vaccine, for people who are in this list, this is planned with the health networks right now, because there are a lot of people who work with the health networks and with the social development. So it is public health that is working in collaboration with the groups like the health networks and social development, the Department of Social Development. Do you have a follow-up? I just wanted to clarify. Are there people who have been contacted or have not been contacted by public health, but they are health workers? Can they go to Miramichi? No, this will be communicated internally by the networks and by people who work with the nursing homes of the region. So there will be direct communication with people, because this is the first shipment. 1,950 doses is not a lot, so we will get other doses of this vaccine, and then we will have another vaccine, and then another vaccine, and by the end of 2021, at the national level, they say by September everybody will get the vaccine, but this is planning that was already done, and this is what we're trying to do. Can I have another follow-up? What do you want to know? I would also like to know, how will you check the identity of the people who will get the vaccine when there will be more vaccines available? Well, this was determined at the national level with 5 groups who gave information on that, and we got the information on all the people at risk, and we determined who are the people here in New Brunswick who are in those groups. But because the number of doses that are distributed right now are very small shipments, all the at-risk population will be done first, and then the rest of the New Brunswickers will be getting the vaccines later on. Eloise Rodriguez Kizilbash. Yes, I would like to know about the timeline. When do you think that the general public will be able to start getting the vaccine in New Brunswick? The details on the planning of the general public, the information that we got was maybe July, but this could change once we get more vaccines. It depends on the number of vaccines that are accepted by Health Canada and the number of doses that we will get. If there are no issues, because there are things that we cannot foresee, but for now the plan is by 2021 or by the end of September we will all be vaccinated if all goes well. Eloise, do you have a follow-up? Yes, please. Since the vaccine cannot be moved, do you have a plan to move nursing home residents to bring them to the vaccine?
I'm not sure I heard the last part of the question, but it was along the lines of, do we have plans to move nursing home residents to the vaccination sites?
Yeah, what is your plan exactly? How are you planning to bring people to the vaccine?
Well, we're working very closely, as you can imagine, with a lot of partners here. And the owners-operators of nursing homes, the Department of Social Development, they all inform such decisions. And where it is logistically simple and where nursing home residents or residents of long-term care facilities are ambulatory and able to come to a clinic designated in a regional hospital in close proximity, that approach will be taken. But make no mistake, there is, as we progress through this, there is every intention to bring the vaccination to people who are in long-term care facilities so that they don't have to travel. Now, this is a multi-layered and quite complex undertaking here, but it is, of course, recognized from the outset here that we are going to minimize transportation of people and certainly avoid any risk of moving people around unnecessarily.
Thank you. Merci beaucoup, Eloise. Bobby Jean McKinnon, CBC.
Yes, hello. Sorry, so just to follow up on that, Mr. McCallum, you said earlier that the first 1950 vaccines would have to be administered at the Miramichi Hospital. So how many nursing home residents will be able to travel there to receive the vaccine? And
how long before you expect to get more freezers to be able to reach more nursing home residents?
Two-part question. First part, in terms of the number of residents in long-term care facilities, we are expecting in the vicinity of 400 people that are residents in those facilities. And again, it's about proximity and ease of being able to transport people to them. Now, there are other seniors who are not living in long-term care facilities who do have the ability and will be invited to attend that clinic as well.
Ms. McKinnon, do you have the quickest follow-up?
Oh, sorry, I guess the other half of that was how long before you expect to have more freezers to be able to reach more nursing home residents?
That is currently very much being worked on, and there is not a shortage of freezers, and I would remind everybody as well that this vaccine does come in dry ice packs which can last several days as long as you continue to replenish the dry ice. So to answer your question, the emplacement of freezers in other locations in the province and identifying those that are available already in place is happening now. At the outset of my prepared notes, I stated that we are ready to receive vaccine going forward now. So there is not a shortage of freezers. There will be some administrative movement of things to make sure they're in optimal locations, but that is already underway.
Thank you, Ms. McKinnon. Erica Butler, CHMA, Sackville.
Oh, thanks very much. This is for Mr. McCallum. I apologize if you've already answered this in French or English. But I'm wondering, will people be traveling from around the province to the Miramichi Hospital to get some of these initial 1,950 doses, or will these doses all be going to that immediate region?
There will be people who will be traveling, but they will be healthcare workers. And you know, when you work with a number like 1,950, you go for some quick successes in terms of being able to immunize those priority groups that are immediately available and accessible, but you also expand the offering of availability to become immunized in this one first shipment to healthcare workers coming from such organizations as the lab at the Dumont Hospital, for example, COVID units in other hospitals. So within the capacity of the number of doses available and within the availability of some health care workers, they will have the option to travel. I would hasten to add at the end of that, or if they choose to wait, there are, of course, regularized subsequent deliveries, which will likely be in a location closer to them.
Ms. Butler, do you have a follow-up?
Yeah, just a quick one. It's a 2-dose vaccine, so I'm guessing there's going to be a matching shipment to these 1,950 doses coming within December. And I guess I'm wondering, so yeah, will those also be going to the Miramichi Hospital, or are you planning to split those 1,950 that are at Miramichi? Do you know what I'm getting at here? Will you be sending the second shipment that's coming in December also to Miramichi, or will that be going to another freezer somewhere else?
We have to assure that when you administer the first dose of the Pfizer vaccine, that you have an absolutely reliable second dose to be administered 21 days later. To that end, the first shipment, which is coming in of 1,950 doses, will be administered because we have absolute certainty that the sufficient quantity for the second dose will arrive very shortly thereafter and will be placed in the ultra-low temperature freezer held in reserve to inoculate that first 1,950 recipients. And that will be the plan going forward, where we will maintain a reserve in the event that there are supply chain interruptions or weather delays or whatever it might be, so that we can be assured that those that have received the first dose will get the second dose at the appropriate time.
Thank you, Ms. Butler. Gilles Duval, CMT, Edmundston.
Oui, bonjour. Les questions que je voulais demander par
My questions about the cases in Edmundston were answered by Dr. Russell, but is there confirmation about could there be people, could the, since the beginning of the press conference, we received news on the situation in Edmundston, and I will be reading what I got during the press conference. I can confirm that there was an outbreak declared today at the regional hospital in Edmundston. 2 patients are in intensive care, and we have 3 healthcare workers working in the intensive care unit, and 1 patient who was admitted today who has COVID. So we are working with public health and Vitalité and in controlling the infection, and we are doing the contact tracing. Vitalité suspended visits except for palliative care, for pediatric care, and in a maternity ward, and people who have appointments today can come, but they have to follow public health directives. And like I said earlier, it is not suggested to go to the ER in Edmundston unless it is something extremely urgent. And you will be getting more details later on. Do you have a follow-up? Yes, quickly. When there are patients hospitalized for COVID cases, is it inevitable that the staff gets contaminated, or can it be avoided? Every situation is different. In the other outbreaks in the province, we've seen that sometimes people, either residents or patients or people working with people in homes, get contaminated, but with all the contact tracing, I don't know, I don't have any details on that. There are possibilities that people go to the hospital and they already have COVID, or hospital workers get infected somewhere else. I don't have any details on the investigations. We'll get the details later on. Thank you, Mr. Duval. Jordan Gill, CBC.
Yes, I guess this question's for Dr. Russell. Will people who opt not to get the vaccine be restricted from traveling, and will there be any sort of immunity passports for people who do get vaccinated?
So it's very early days at this point in terms of what types of restrictions will happen in the future. I can't really comment too much on that, other than I'm aware those conversations are taking place. And I don't see anything different happening with respect to the public health measures that are in place right now. If other countries or airlines, et cetera, decide to impose different types of restrictions themselves, I'm not aware of that at this point in time. So certainly we will keep monitoring the situation, and we'll keep listening for more information on that. But I don't have any other details at this time, other than I'm aware those conversations have taken place.
Mr. Gill, do you have a follow-up?
Yes, I guess this is for whoever wants to answer. And PEI, the owner of a tuna processing facility, donated some of his large lab-approved freezers to the provincial government to store the Pfizer vaccine. The PEI government took him up on the offer, and he's making the same offer to the New Brunswick government. Will New Brunswick be taking him up on that offer, or is there an alternate plan in place?
Thank you for the question. We are aware of that offer, and it is being considered. As I mentioned earlier, we are inventorying all available both freezers that will go to -20 and the ultra-low temperature freezers as well, of which this is one. We are going to acquire a few more details from the kind gentleman who made this offer, but it is our intention certainly to factor that into our considerations, and if we identify a need for it, we'll certainly be in direct communication with him about that very generous offer.
Thank you, Mr. McCallum.
Thank you.
Thank you, Mr. Gill. You got two, right? Merci beaucoup tout le monde.
Thank you very much, everyone. This concludes today's update.
Concludes today's session.